morning, ladies and gentlemen. I'm Claire Kim, your MC for today's lecture. It's my great pleasure and privilege to welcome you all to the 82nd Societas Koreana lecture meeting. I'm delighted to welcome Dr. John DiMoia, Associate Professor from the Department of Korean History at the Seoul National University, who is going to give us an insightful lecture titled Starting from Mosquitoes, South Korean Public Health and Approaching Crisis 1959 to 1973. Okay, before we begin, I'd like to briefly introduce Dr. DiMoia. He achieved his doctorate degree at Princeton University in 2007 and joined the Seoul National University since 2018 as developing the research area of modern Korean history. Now, please welcome Dr. John DiMoia with a warm round of applause.
Thank you very much for the very kind welcome, and I want to thank AKS for giving me the opportunity to present to you this morning. I am John DiMoia from Seouldae Kooksohakwa, and as noted, I will be talking about starting from mosquitoes, South Korean public health, and approaching crisis 1959 to 1973. And I think by way of getting started, I can very simply say that I'm going to talk about the domestic and regional contexts for the beginning of South Korean public health. But I can say in a sentence, basically South Korea has been doing public health almost from the moment of Haebang, and that's perhaps one of the reasons why it has achieved the success that it has. But I'll explain more about that as I move forward. Yeah, so in today's talk, I'm not going to be talking completely about the background of my book, but I want to mention it in the background because some of what I will talk about is in chapter 5. So the book is background, but what I'm really going to talk about then is three things. One, the immediate context for South Korean public health domestically in the anti-malaria campaigns that begin after the Korean War, early Lee Sung-man period. Late Lee Sung-man period. Two, I will talk about Vietnam and the Southeast Asian context and how South Korean doctors, medical professionals, nurses begin to move to Vietnam and Thailand and a few other places. And this is the beginnings of South Korean public health, moving abroad, gaining more knowledge. But actually, much of the knowledge gained in Southeast Asia actually later has an implication for domestic Korean public health. Part 3, depending on my time and how I go, I will talk a little bit about new directions, of course, what people are interested in, why and how is this connected to the COVID situation at present day, but also I can talk a little bit about MERS and SARS in the early 2000s, the last 20 years of Korean history, and how this also is very much connected to the past. Okay, I have to be honest, as a historian, I feel guilty. I'm leaving out a lot of time. So obviously, in talking about Korean public health, one could easily talk about late Chosun 시대부터 지금까지 if you wanted to. I'm not going to do that. I'm going to talk just about South Korean history. But in the interest of paying acknowledgement to colleagues who have done this, if anyone is interested in particular, late Chosun public health, hygiene, the work of Shin Dong-wan at Cheonbukdae, Kim Jong-ran at Oxford, just to mention a few colleagues. Moving forward to the colonial period, the work of Kim Hae-eun at Texas A&M, So So-young at Dartmouth, and even more particularly Park Jin-kyung, who is at Waydae, also all fantastic scholars. Just want to mention if you're interested in this background work. What I'm going to be doing again is talking primarily from the moment of Haebang forward, 1945, and talking about how this begins the building of a South Korean public health system, and I'll talk about how and why I think that started to happen. Okay, so part 1, domestic. As I mentioned at the outset, what I'll be talking about is from the later Lee Sung-man period, and in particular, this is the beginnings of a South Korean public health system for a variety of reasons. There were earlier attempts, particularly under Japanese colonialism. I will argue that the Japanese actually did not penetrate the Korean countryside very effectively. And in fact, this is one of the reasons this campaign, the National Malaria Eradication Service. Officially in Korean accounts, it's usually dated to the early 60s to Park Chung-hee. But as I will try to show you briefly, some of the documents, these documents both come from the WHO, the World Health Organization. And I was lucky enough to visit there 2 summers ago. This last summer, of course, one could not do much research. The WHO is helping the Koreans after the Korean War to start to kind of consolidate, build up the countryside, and this becomes in many ways the first really effective campaign. The other thing I should mention, and it's coming up, but I'll say it now, is that it's actually not the Korean government that is so enthusiastic about this campaign. It's partly the American military. American soldiers are getting sick from malaria. So the Americans complain to the Koreans and they say, look, we're getting sick, like you have to help us. So this becomes a joint WHO American Korean-led effort. And I will argue that in fact, some of these partnerships and relationships are extremely important in building up effective public health. Okay, just a few images to give you some views of what the campaigns would have looked like. On the left, again, a WHO document, an image showing that malaria was particularly prevalent on the east coast of the southern half of the Korean peninsula. Obviously, if you go back, if any of you are interested, to longer history of malaria in Korea, there are excellent records for the Japanese period. There are probably records obviously going back to Chosun, but particularly in mid-20th century, again, it gets very interesting and obsessive because this is a symbolic way of rebuilding Korea after the Korean War. And again, Americans and other interests are very worried about getting sick, so there are multiple actors working together to make this work. On the right, a nice malaria Pangmyeol Undong campaign stamp to remind you of the kind of the official start of the campaign in 1962. But again, the pre-surveys take place as early as 1959. And I wanted to kind of mention that because I often think that Lee Sung-man doesn't get all the credit. Many of the medical efforts that really grow during Park Chung-hee actually have their starting point a little bit earlier. So it is worth mentioning that. Okay, but this is where I think it's really important. Why is this particular campaign so important in terms of Taehan Minguk, Bogan practice? Because it really reaches the Korean villages. It really builds a network. It gets out there much more effectively than the Japanese did earlier, and certainly much more effectively than the limited public health during Chosun Shide. A couple quick examples. On the left, you see, and I apologize, I'm not sure about the resolution for these images, so I'll try to explain. But on the left, an image of a Korean sort of village hut and an image of even how this structure would fit inside a Korean village. Very detailed obsessiveness about where do mosquitoes grow, where do they breed, how do they breed, and more importantly, how can we stop this or limit this? On the right, even more interestingly, pictures of WHO personnel going to visit these Korean villages, going out to check children and adults, do surveys of their health, look at different breeds of malaria, whether it's Vivax or any others. Really getting out into the countryside. Again, a quick observation. Japanese colonial authorities claimed that they did this during the 1930s. Often they were interested in urban public health in Korea, where they could reach places like Seoul. They were not very interested in the Korean countryside because there were not a lot of Japanese settlers. They did not care so much about the Korean population. This is one of the reasons I would argue this is much more important and effective, and Koreans begin to embrace it because they recognize that it's a good thing. Okay. So again, I'm moving fairly quickly, but just to summarize very quickly why I think this particular campaign, which starts in 1959 and which unofficially begins to limit malaria seriously by the late 60s, early 70s, and officially at some point in time, Korea will be declared malaria-free. Unfortunately, some of you might know, and I might as well say it, Korea now has a malaria problem again since the early 1990s, and that's because you can't control the malaria that comes from North Korea. And we'll talk about that later. It's an interesting thing. This is why Beyond Borders matters. If you can't, mosquitoes don't follow borders, in simple terms. And you will often notice on malaria maps today for Korea that the worst malaria problem is near the DMZ. This is not a surprise. But to come back to the slide, collaborators and partners and the responses and sharing between those partners, I would argue, is one of the reasons why this campaign is so successful. A couple quick examples, and I've already said this, but it's worth repeating. The WHO, the World Health Organization, is very big in sponsoring the infrastructure for this campaign. Korea is just recovering from the Korean War. They need a lot of help. The US military treats this not just as a disease problem, but as an actual military problem. This is the Military Assistance Program. They realize that this is actually a serious issue that has almost national implications, so they get on board. So in essence, to repeat it, this is a domestic campaign, but it has all kinds of implications for South Korea's infrastructure, and moving forward, as we'll see in just a moment, it has implications for what will take place soon in Vietnam. Again, the resolution might not be wonderful here, but if you can read the poster, it's malaria mogiga cholyam hanta, and you see kind of a very large, oversized mosquito attacking what's probably an innocent Korean guy, and he's kind of surprised and disturbed. This, again, is to show you both humorously but also seriously how serious this campaign was viewed at this time. And again, this carries forward into the early 1960s, which lets me talk about part two. Okay, so part two, what I'm going to call the nearest faraway place. Vietnam, but not just Vietnam. Thailand is also important in the background. Southeast Asia. To recognize that the Vietnam War for Koreans is not just about war, but very, very much about medicine and public health. And let me try to explain how that works. Yes, on the right, a picture of a Vietnamese boy receiving a haircut from a Korean soldier. Why? I still don't know the complete answer, but I'll tell you what I think. And I'm actually writing a separate chapter about haircuts in Vietnam. The Korean military actually kept track of the number of haircuts they gave. It's public health. It's not accidental. They can keep track of how many children and adults are in villages. They can keep track and do a quick public inspection whether there's any infections. They can check by keeping the hair short whether there are any parasites, typhus, anything else like this. So these haircuts become a really interesting way of psychological outreach to villages, getting friendly, feeling comfortable, but also combining it with public health. This will become really, really important in the Vietnam context for the South Korean military, and also for the so-called Bidulgi Brigade, the South Korean civil affair pigeon forces. Okay, now there's some background here. South Korea is already doing anti-communist public health as early as 1954, so let me give you this quick example. I'm assuming a lot of people don't know about Operation Brotherhood. This was a Philippine campaign to aid Laos and Vietnam in the mid-1950s, Jesuits, and also a little bit of, to be honest, a little bit of CIA support in the background. Why are Koreans involved in this? The picture on the left, you will see the Korean JCs standing in front of a large number of boxes. The picture on the right explains what they're doing. Symbolically, even though the Korean War is just finished and Korea is very poor, they're sending medical materials to the Philippines, and those materials can then go to Laos or Vietnam. So they're already creating a network with other free world countries to begin aiding countries that are under war. They see this as, we went through the Korean War, other people helped us, we need to repay this debt. This is how we're going to get involved. You might not be able to make it out, but all of those boxes have little taegugi on them. And they also read to Manila, so you can get the context of this is the Koreans, even finishing the Korean War, starting to get involved in new networks of free world partnerships. In this case, again, the Philippines and Laos. Catherine Sweet and Simeon Mon have written about this. If anyone's interested, I'm just throwing in the background. Vietnam is not the first anti-communist medical effort. But this is what we want to talk about. So the first group to arrive of Koreans in Vietnam in September 64 is actually a medical unit, a MASH, a Mobile Army Surgical Hospital. Just to give you a little background, the second Korean unit to arrive later in the next year will actually be the Bidulgi Pigeon Brigade, civil affairs and taekwondo guys. Korean troops actually don't arrive until the third group. So Korea went into Vietnam very softly. Here's some medical guys, here's some civil affairs people, we're nice, we don't want to fight. This again was about psychological outreach, trying to create an impression of brotherhood first. A little bit of background. When Koreans moved to Vietnam in September 64, they set up at a place called Vung Tau, as mentioned in the previous slide. This is southeast coast of Vietnam, outside of Saigon. This is not accidental. They are taking advantage of existing French infrastructure left over from the colonial period. So there's kind of a weird, interesting post-colonial, colonial connection here. Just a little bit of background. But just so you can see, these are two images of the Korean hospital, the MASH unit outside of Saigon. And this was officially meant to serve only civilian patients. They won't get to treating war wounds, soldiers until later. But again, this is trying to keep the war to a minimum, trying to almost pretend that there's not a war going on. This is very symbolic at the time. What are Koreans doing in Vietnam? And this is where it gets really interesting. As I already suggested, they're doing free haircuts. I'll show you that again in just a moment, so we don't really need to talk about it. But a couple common things. They're doing vaccinations. They're giving all kinds of injections, chusa, for all kinds of diseases. And here is where you begin to get the connections between Korea at home and Southeast Asia. Some of the same doctors, a couple examples, So Byung-sol at Seoul, So Jin-tak at Yeondae. Some of the same doctors who run the anti-parasite campaigns, Ki Sung-chung in Korea in the 60s, are in charge of keeping track of Korean soldiers in Vietnam. So it might not seem to the average person like there's any relationship. This is home, this is Vietnam. But actually the data is shared in common. You will see comparative studies between Korean soldiers, Vietnamese soldiers, and Korean patients back home. So what Koreans are learning in Vietnam is extremely useful in improving the quality of care back in Korea because they can learn from Vietnam and then do better back home. Okay, so anyway, vaccinations, senior care, taking care of older Vietnamese, and especially neonatal care, taking care of babies, trying to make sure that Vietnamese children are healthy. The image on the right best shows this. You see two Korean military doctors working very hard, and you see a line of Vietnamese bringing babies, bringing their patients to be examined by these Korean doctors. Okay. Are there problems? Are there issues? Are there tensions? Do Koreans and Vietnamese get along? This is a war zone. Let's not forget there are some tensions. Koreans aren't always sure how to react to Vietnamese. Vietnamese aren't always sure how to react to Koreans. This is not a Korean image. This is an American poster put together by something called JustPal, the Joint United States Public Affairs Office. We're going to show the Vietnamese how our Korean brothers can be trusted. This is Romanized Vietnamese. If you read down below, it says roughly, the Koreans are fighting for you in the field on the left. They are also fighting for you or taking care of you in the hospital, in the medical site. And again, you might be able to see the taegugi on the helmet of the Korean military doctor. And as I suggested earlier, you see Vietnamese patients, you see mothers bringing their babies. This is very typical of Korean relationship to the Vietnamese, 65, 66, 67. But you can see from this poster that there's some tension. The Vietnamese aren't quite sure. The Americans have to explain to them, you should trust these guys. Don't worry about them. Okay, and to say a little bit more about that issue of trust. Officially to the Koreans, these are called civil actions, civic actions, Daemin Waltong. And this is a publication on the left that is put out by the the Korean military headquarters in Saigon as a kind of guide to soldiers, how you should behave in Vietnam. And I'm only going to show you a few images from it. But to the Americans, this is a part of psychological warfare. They do want the Koreans to interact with the Vietnamese because they think that the two Asian groups will get along better than Americans to Vietnamese. So just background. But on the right, another image from this same book, Daemin Waltong. Again, you see a Vietnamese boy receiving a haircut from a Korean ilbasol barber. And wonderfully, you see the Vietnamese senior guy looking on, kind of happy. And again, I want to suggest to you that if you don't know the medical context, this is very confusing. But I would argue, again, that this is very much public health. Even though it says nothing about health in the poster, if you know the background, this is a haircut that has all kinds of other things going on in the background. And another image, just to continue this theme of Daemin Waltong, but also because I really like this picture. This is a Vietnamese baby receiving chusa, an injection, from a Korean soldier. And I don't know if you can make it out, his facial expression. I always like to think that this Vietnamese baby is very outraged. He's very angry. He's not happy about, well, most of us are not when we get an injection. But he's particularly unhappy, even though his mother is smiling. And in the background, there's another Vietnamese baby kind of looking on, going like, oh, what's going on there? But again, I want to emphasize that for much of the Vietnam War, even if it's presented as a war, and it was a war, Koreans were doing very active, very high numbers in the thousands of patients trying to do outreach to Vietnamese populations because Korea, very importantly, believed in the South Vietnamese government. And to give you a quick version of it, there are propaganda posters in this same book that show a direct relationship between the 17th parallel and the 38th parallel. The Koreans basically say to the Vietnamese, you are divided, we understand. This is our way of repaying our debt from the Korean War. They thought the South Vietnamese would win. They didn't know, of course, at the time. History turned out to be a little different. Okay, let me start to wrap this part up a little bit. So this is where, I said this earlier, but this is where I can really make the network point. Again, the same doctors that are running these campaigns in Vietnam, So Byung-sol, Sojin-tak, are running the Kisaeng-chung Pangmil campaigns in South Korea. So if you know the anti-parasite campaigns, very famously, school children receiving the pills from their teacher beginning in 1969, this is very much connected. These things are not accidental. And in several cases, Koreans are building a series of partnerships. So let me just say them very quickly. Koreans are connecting with Japan in these campaigns because it's after 1965. Japan is giving the microscopes. Japan is giving some of the basic technology. Vietnam is partnering so the Koreans can go to Vietnam. And the United States is also partnering. I'll just show you in a couple slides. They're hiring Koreans to do epidemiology during the Vietnam War. Because it's a war, they're afraid to go out into the jungle. And they pay the Koreans and say to them, could you gather data while you're out in the jungle? And they actually do this. I'll talk about it in a moment. But so these three partnerships, again, are very important in building public health relationships. Okay, just having said that, let me repeat this in a little more detail. Yeah, again, connections. So the first one up here, APCO is the Asian Parasite Control Organization. This is Japan and Korea in 1974 saying we know about parasites, both of our countries dealt with this, we're going to help Southeast Asia. That's where some of this Vietnam history turns later. Korea becomes very good at teaching other countries what they learned. That's Japan and Korea. Number two, Mark Harrison and Sun Ving Yim. Sun Ving Yim is my colleague at Kyunghee. If you're interested in this Vietnam history in more detail, War on Two Fronts, Vietnam and Korea at Home. Absolutely wonderful article saying much better than I can say. A little bit of background. And as I just suggested, Koreans going out into the jungle, gathering data. It's called COPREM, Korean Preventive Medicine. This is paid for by USAID, the United States Agency for International Development. All of three of those relationships, Japan, Vietnam, the United States, help the Koreans learn in Vietnam, take that information back to Korea. Not surprisingly, Korean public health benefits. People get much better treatment. They know how to do it better because they've already practiced in a war zone. Practicing it back home in a peaceful place is much easier. Public health starts to improve very radically, late 1960s. Okay, and one more example. I can't resist. Korea is also going to Africa as early as 1968. Now, these are very small numbers. This is like maybe one or two doctors, one or two nurses. Often they are married. This is sometimes called in Korean the Africa Pagyeon Wisa Sansinim, Africa Dispatch Doctors. They will go to places in Africa that are newly decolonized. They will say to them, we're going to help you. Hi, we're Korea. And they will say, see those other Korean guys? Please ignore them. Don't talk to them because those are probably North Koreans. This is about diplomatic recognition. Taiwan and China also do this, compete around the world trying to do this in the same period of time. If you're interested in this, I don't work on this, but scholars like Ben Young and Junyu, who's at Yonsei, do. So there are people starting to write about this. There are lots of documents in the Korean archives, particularly the Foreign Affairs. It's a very interesting story. But you can feel, I started with domestic, now Vietnam, now Africa. Korea is growing and starting to move out into the world, starting to become a little bit like the South Korea we have today. Okay, so let me, in part three, start to wrap up and talk a little bit about new scholarship, new possibilities, and just remind you, I hope I've talked about, or I hope it's been clear, I've talked about the domestic program, malaria eradication, talked a little bit about Vietnam, and I've tried to make the connection. Let me make a jump from the 1970s to almost the present day. I apologize in the interest of time, and talk about why is all of this relevant for us today. These images come from MERS, the Middle Eastern Respiratory Syndrome, from 5 years ago. I was here that summer, and some of you might remember how kind of frightening it was. These are both posters taken from Incheon-gonghang to remind people about, you should be careful. It's funny, I mean, we're now wearing masks. We weren't wearing masks all the time then, but maybe we should have, but we're starting to be conscious of it. Why this is really important, some of you might know. SARS in 2003, 2004 is when Korea creates the KCDC, the Korean Center for Disease Control. 2015, when this happened, is when the Korean government passed a new law, maybe December, late 2015, saying now we need contact tracing. Exactly because in this situation, some patients moved hospital to hospital and they spread the disease. And the Korean medical people were like, wow, we need some way of tracking them. So the contact tracing that we now know and is very famous probably comes from this. And again, it's to show that this public health history is very relevant to our current situation. But let me say a few kind of larger points. Yeah, if you're interested, again, I can't resist the opportunity to say good things about my colleagues. This is a much more contemporary story today. This is Park Young-soo, a Stanford PhD in medical anthropology. He also has a medical degree, so he's an MD PhD. And he writes about Korean medical efforts in Ethiopia today, from the time of the Korean War until the present moment. Why am I talking about him? One, because he fits really nicely with my story of Korea growing, starting to teach, moving into the world. But two, because he's a medical anthropologist, he does a very good job of criticizing as well as praising what's going on in Korean medical efforts. And I think we need both sides, the feedback mechanism of, okay, this is good, but also how can we get better if we want to move forward. And again, I just highly recommend his dissertation. He hasn't published a lot yet, but he will be publishing more. And he's one of my only colleagues I know that really knows Africa very, very well in terms of its relationship to Korea. But let me say a few more things. Okay. This is the second book that I had mentioned earlier, just to give it a little publicity in addition to my first book. This is not just me, this is three of us. This is my colleague Hiromi Mizuno, Aaron Moore, and myself. And this is a project about Japan, Korea, and Southeast Asia in the 1960s and 1970s. So much of what I've talked about in part two in Vietnam comes from this particular book. And the other reason I'm mentioning the book is it's transnational, it's comparative, it's the kind of approach that I want to take to my own work. I want to talk about the Korean nation, but always in the context of the region and other nations. So I just mentioned this as a way of thinking about how to think about Korean history as we move forward. But I do have one or two more slides to offer some broader points. And that's this. I've said a lot here, and I want to make sure that it's clear like what I think is the most important things. So what are some of the elements, the common factors, both in the domestic program that I mentioned and in Vietnam, and even for today? A couple take-home points. Number one, networks penetrating. You don't get into the villages, you don't get into the countryside, you don't reach everyone unless you have partners at all different levels. It's really challenging. And as I suggested earlier, in the case of malaria today, South Korea almost has to collaborate with North Korea, because if you don't, the North Koreans have their problems and then they come across the border. And again, mosquitoes do not obey rules. It's why Korea has a problem now with COVID. It also has to think about China and North Korea for COVID. These relationships are important. Number two, hardware and technology. I haven't talked much about it today, so it's worth emphasizing. In a public health situation, sometimes sophistication isn't always what you need. Sometimes very simple, easy to transport. Things like COVID, Korea contact tracing and being able to do it very quickly in very small places, masks, face shields. In Vietnam, you had to go to the jungle and test people almost out in the open space. Easy, mobile, transportable technology is often very, very important in these large-scale public health campaigns. Sometimes it's almost even better than a really nice lab, but you can't move that lab out into the jungle or into the countryside. Number three, psychology, selling the program, outreach, getting people convinced about why should they listen to you, why should they take you seriously. These are important things. I guess I want to say this, and this is almost the last slide or two. Resistance is very common in public health situations. We see resistance today. Some people don't want to wear masks. Not everyone in some of the Korean churches wants to listen to the Moon government. It is controversial. What I want to tell you as a historian is resistance is not new. It happens in every public health campaign. You have to learn how to talk to people. You have to learn how to sell the program. You have to learn how to explain to them why this is important to you and how it's potentially valuable to you. So I guess, yeah, it's a nice way of wrapping up. Resistance is depressing, it's frustrating, but it's very much common. Any historian who does public health can tell you this. Okay, so what is the present and future of Korean medical diplomacy? Obviously, I don't know the answer, but I want to kind of hint ahead and suggest that Korean outreach, developmentalism, has all kinds of potential. Many people have things to learn from the Korean experience of COVID. And I've heard people starting to call it K-quarantine, which is to say, if Korea has been successful, K-quarantine kind of means this is like the package of technologies or ideas that Koreans want to teach other people about contact tracing, things like this. And I think this will become, in the next couple of years, part of the experience as we come out of COVID, hopefully by next year. But I want to wrap up with this last slide, which I hope none of you have ever seen before, and it's kind of funny. And well, to me it is. And it's to emphasize the point earlier I made about resistance. Which is to say this. In wrapping up, since I've already, again, talked about from the beginning of South Korea, Haebang, and I talked about the domestic program, and I talked about Vietnam. What I want to suggest is that public health has been with South Korea very much since the moment of Haebang. So these two images to explain. On the upper right, a Korean gentleman. This is actually not Haebang. This is probably the Korean War. But there are many of these images from Migunjong and Haebang. This is a Korean getting sprayed with DDT right after during the Korean War. He does not seem happy. We could argue that he's resisting. Public health and some kind of resistance has been with Korea, South Korea in particular, right from the moment of 1945. And to emphasize that last point, on the left, this is Busan. This is fall 1945. This is a massive quarantine station that is being set up because thousands of Koreans are coming from Asia back to Korea. Thousands of Japanese are leaving to go back to Japan. And with all those bodies moving on ships, they were really worried about something like what we have now. So I realize you guys might not be able to read all those, but I'll call your attention as people are coming back to Korea and going to Japan. Two of those stations, one of them says delousing and the other says inoculation. You have to be cleaned and we have to give you a vaccination. Again, this is September 1945. South Korea experienced multiple public health crises at that time, has gotten the experience from this crisis, from the Korean War, from the Vietnam War. All of this legacy of experience has, in the end, ultimately turned out to be a good thing in that Koreans have learned a great deal. And I think that's partly why there has been some success in dealing with COVID. And hopefully that will continue into the future. I thank you very much for your attention. And I look forward to feedback and questions afterwards. Thank you very much.
All right, thank you very much. It was really informative, and for some reason we have been under this quarantine. We are very familiar with the terms of quarantine and disaster and then bacteria, whatever. But thanks to doctor's lecture, I come to know the Korea's vaccination and then also the several actions to others has been really great legacy, and it's not it just happened just over one day. It's been more than 50 years. I really appreciate your insightful lecture for all of us, and I really wish everyone who watched this video will get to know what really happened over the wars and really serious times days. This is the end of today's meeting of the 82nd Societas Koreana lecture meeting. I'd like to really thank you again for being with us today. Thank you.